Along with my co-host, Ruse, and welcome to another episode. And what's going on, man? It's been a couple of weeks since we last recorded.
Yes, we have.
A lot has been going on.
A lot has been going on.
Yes. And so we're going to get into those lots of things shortly. But I just wanted to, just check in with you first, ask you how you're doing. How's life been? How's the family?
Life is good. Thank you for asking. Mm-hmm. Everything is the way it should be.
Okay, love it.
On most things, on the family side, work and politics and the world. I don't know, man. It's like I'm looking outside the window and I'm going, what's going on? What's going on? And the ripple effect is across personal, academics, work, careers, like everything. I feel like the world is in topsy-turvy. So I figured it would be a good time today, instead of talking about our usual topics, we dive into some, social issues within our... What do you think?
No, I absolutely agree. I love this direction. So if those of you don't know, New York nurses are at this time, I don't know when we're going to release this episode. There's a lot of union negotiations with major hospitals and possibilities of strikes. And, I wanted to get into just the overall federal, just U.S. healthcare system, and where it might be failing from a nurse's perspective. So that's what you can, mostly expect from this episode. And, wherever this conversation takes us, it can go a lot of different ways. But the first thing I kind of wanted to just bring up is one of the, I was really thinking, and I was asking you yesterday, what's the number one thing that nurses are, I guess, I don't want to say fighting for, but yes, what do they really want? What do they really want? Why are New York nurses, or just nurses in general?
Nurses in general, right?
But why are nurses really upset, or what are they upset about? And the nurse to patient ratio is probably, in my opinion, and I could be wrong, I would love to hear your feedback, but in my opinion, that's probably the number one thing that they're concerned about.
Tell me more about that. Why do you think that's more important as opposed to salary or something else? Well,
so I've been a nurse for almost 10 years, if not 10 years already. And I've seen a possibility of a strike happen multiple times. And it's never gotten, this far where it could possibly go, next week. But it hasn't gotten that far because, they've always given more money and, we've taken it and then not really fought for the overall big picture of where we are now, which is safe patient ratios. So I don't want to say we've always shut up, because they've just thrown us more money, but that's, in my head, that's what happened. And so now we're at a point where, COVID happened, and nurses are, extremely burned out. They haven't really had a break at all since COVID. It's been a small reprieve, but not much. And they're just overwhelmed. Managers are overwhelmed. Directors are overwhelmed. I can only imagine CNOs. You got to be overwhelmed too. Yeah. Everybody, every system is overwhelmed. Yeah. So, when you have all this overwhelming, I guess, factors and experiences, it puts a strain on the nurse. It puts a strain on not even just the nurse, this all of us, all the medical professionals. It puts a strain, and that strain can spill over into your personal life if you let it. And it just causes a domino
work, you bring
effect.
It home. Yeah.
It's just a domino effect of just stress. And, that's to me ultimately why we need, to to figure this all out, because mental health is extremely important. Just living in a capitalistic society, anxiety is the number one mental health issue that we're all facing, and it's extremely prominent, and ultimately
to various degrees, absolutely.
And it's just we have to figure something out. So yes, nurses are burnt out, nurses are tired, and that's ultimately why I feel like that should be the number one thing that we're all fighting for, not money, because at the end of the day, we're going to get taxed on it anyway. Like, the more you make, the more they take. So, like let's get some safer patient ratios, in my opinion.
Unless you know the political loopholes.
Yeah, right. What about you? What's your opinion?
So for me, I've lived through a couple of potential strikes. I actually came into a couple of professions of mine and careers of mine on the loom of strikes, and you're right, it's never gone to this point, which is frightening. But the most important thing, I don't think there is a most important thing. I think as a collective, we need to define whether we want solutions that are short-term or versus long-term, and how much are we willing to sacrifice if we do choose the long-term. Mm-hmm. Because there is a sacrifice. And then we also got to keep in mind that, healthcare is altruistic in some level, but it's still business on another level as well. Yeah. Whether you work for somebody or you work for yourself, you know that at the end of the day, if the revenue is not there, if the people are not there, it's like owning a pizzeria, you don't know how to make pizza, and your pizza man doesn't show up.
Yep.
Right? It's a highly skilled profession, right? Not everybody knows how to make 10 pizzas every 15 minutes or whatever,
Yeah.
Nurses are the same thing. We're in a profession that it's highly skilled, it's not easily reproducible, which makes it a commodity, but at the same time, it can't be used as a sledgehammer either. The other side of it is understanding it is a commodity, it is a limited resource, and as an owner, I need to know how to make sure that my staff doesn't feel like they've lost their leaders, right? That the company hasn't lost its humanity. And it's a razor edge sometimes. It's a razor's edge that we walk on. So for me, patient ratios is important, right? It's one of those things where it really can make or break a lot of different things for both sides. If it's unrealistic, it can damage you. If it's realistic, it can damage you. And when I say damage you, I don't mean you as the immediate bedside nurse necessarily, but as a system, as a healthcare, as a continuation of this, gear that we're all part of, right? This machine that we're part of. And the ripple effects is something that I personally have to keep in mind. Not everybody thinks about it that way, right? Not everybody thinks that what I do today might affect me next week, next month, next year, 10 years down, my next generation, right? Most people want to know at the end of the day, they feel respected. They're getting a wage that they're comfortable with. That's reflective of what society demands of it, right? Inflation, all that jazz. So patient ratio is important, because it affects patient safety and satisfaction. I think there's a direct correlation. But at the same time, though, where are we going to draw that line? Right? We have to be realistic with that line. And I think one of the things that we need to keep in mind is that the distribution of money throughout the system, which is going to take us down a very different path, right? But the distribution of money throughout the system needs to be addressed. In order for you to be able to do X, Y, and Z, then we need to look at the system and go, okay, where is the money going? Where is it flowing? And this is not an invitation for people to badmouth their CEOs or their CNOs or their CFOs. God bless them. They do an insane amount of work. It might not seem like it to us, right? But it is an insane amount of work. And the level of hours that they keep is insane.
And the level of stress as well that they have to endure or manage.
And uncertainty. Uncertainty, right?
Yeah.
Just because you think they're your boss and they can't, nothing can touch them, but guess what? They also have a boss. They have a board. They have these things called, shareholders, right? And we live in a capitalistic society where at the end of the day, your profit margin will define whether you did well or not, even if you still made a profit, which is the odd thing, right? Last year we made and I'm making arbitrary numbers up. This is just for examples purposes. Last year, let's say my company made $4 million profit. This year, I made $2 million profit. As far as the system is concerned, I lost $2 million. They don't see it as we made a profit of $2 million, meaning after all your expenses, after all your bonuses, after all your whatever, right? Yep. It's an interesting thing that we live in. So for me, I want society to look at how we distribute funds in a way where it's realistic. Give the guy $1 million a year. Give the girl $1 million a year. They earned it. They work 24/7. Anything goes wrong in that hospital, the first phone call is to them.
Yeah.
Right? They don't get to take vacations. They work. Right? So, it's...
So I'm actually in the school of belief that I believe CNOs and CFOs, I think they should get paid what they get paid. I'm like, that whole argument, well, if they're getting their $1 million bonuses and we're getting this, like, nah, I'm sorry, guys. Like the amount of work and stress that they have to endure, like I said, to me is worth it. It's deserving of it for the most part. I'm not gonna lie.
It's a question then?
Go ahead.
Okay. Do you think it should be the upwards of like 5 or 6 times the amount of anybody else? Do you think their workload is 5 or 6 times the workload of anybody else, to the point where, like, if as a nurse I'm making $100,000 a year, they're making $500,000 a year. At the end of the year, I might get a bonus of a couple of grand, less than 10 usually, right? Mm-hmm. But they will get an equivalent of my year's salary, maybe, for one bonus.
So,
because I'm all for bonuses. I'm all for being paid properly and even being appreciated, to the point of, listen, you're a CEO, you make $1 million, but your bonus shouldn't be 3/4 of your, or more than your, I don't know.
So as the CEO of a company, right? You're like the middleman to the board of directors and I guess hospital management. So you're like the captain of the entirety of the ship. So you have a responsibility for that goes on within the ship, and you have a responsibility for the destination of where the ship is going. So I think because you have that responsibility, that overall responsibility of everything, even the parts that you can't see or you don't see. I think
you have to anticipate the future.
I think your brain is always on. I think that you have to be, if you're good at it, I think you have to be a tactician. And if you've made organizational changes, like if you've actually done a deserving work to make organizational changes and bring in that revenue, I see no reason why you can't get your $1 million bonuses. I mean, because to me, what is the point of climbing the ladder? Like that to me should be like a
the
corporate,
right?
Just want to be at the top of whatever it is industry that you're in, and to be a CEO and to make that, and then ultimately you'll be a board of directors, be on somebody's board of directors.
Hopefully.
Yes,
right.
like that. Like that's
right?
the corporate ladder dream. So, in my opinion, if you want to be LeBron, which is equivalent to a CEO of a business, and make that much money, then I think, hey, I'm not gonna lie to you. I understand. I get it.
So, do you think there should be a limit to that then?
And that's and that's where I do think there should be a limit. Now, what that limit is, I don't know. I don't have that answer, but I do think that there should be a limit, because that CEO would have never have gotten there if it wasn't for the people. If it
the
wasn't
lowest
for the
totem pole.
Yes.
Right?
Yes.
I'm of the mindset that you're as strong as your weakest link. Right? As corny as that may sound, it really is true. After all these years, I've come to that conclusion. And if you consistently allow your links to, you're going to break that chain.
Yeah.
You're going to break that chain. Do I think that as a CEO, as a CFO, as a CNO, as you should be making buco money? Oh, hell yes, because that's the incentive. Do I think should be like 10 times the amount of, the people who are doing the physical, right? The physical work for you, right? The labor of it. I think there needs to be a balance. And like you said, I don't know where that line is.
Yeah.
But look at society. If you're making $1 million a year, you're not really struggling, to feed yourself or put a roof over your head, unless you're really bad with money, and that's a different conversation, right? But under normal circumstances, most people can live off of $1 million very happy. And if once a year you get a bonus of another $1 million or whatever, good for you. But does it need to be 5 or 10?
No.
Because you can reinvest that into the company. You can reinvest that into, So to me, there is a level of greed that has to be acknowledged here. And I keep this podcast as transparent as possible. And without me throwing myself under the bus too long and too far. So no company ever hires me again. And I hope that's not true. But the reality is, I think there needs to be a balance. And without that balance, you get situations like where we are at now. Here's the flip side of it. Unions were good, bad, or indifferent.
Me personally, I think unions are necessary for hospitals. I don't think every hospital needs a union, but I do think some unions or some hospitals need unions to keep the organizations in check. So, that's a relative. I'm going to give you a relative answer to that question. Yeah. But ultimately, I like unions are important. In some respects, you have to have them for organizations that don't care too much about the people, but just only care about the profits. And then those organizations, because
they do exist.
Yes. Exactly.
They do exist. Yeah.
And so those are the organizations that need those unions. Is what I'm getting at.
Yes. And I completely agree with that. I can't even play devil's advocate on that because my sentiments are exactly the same on that one. The only thing that I have to add for unions is that if you're a union member, if you're paying dues, you're the consumer. They should not be your brain and eyes and ears. Now, I said this to somebody recently, and they said to me, well, your elected official, right, your senator, your governor, your mayor, your whatever, you elect them, and they do what they usually do, right? And you don't go questioning them. But the reality is, yes, we do, right? Every election, we get to either replace them or give. Within the union, we have the same thing, but it needs to have participation on the same type of level, right? The expectation then should be that you as a union member should understand and vote. There are unions who become elected, and there's an election process, but there's no ratification, right? And ratification, for everybody who hasn't heard that term, that's when they come back to you as the union member again after they strike a deal. And I was under the impression that all unions were supposed to do that. And I come to find out not all unions do that. Even within the same union at different hospitals, they might operate slightly differently, right? So I might come to you and say, okay, Mr. Brown, management says X, Y, and Z. We think it's okay. We need input from you. There are other unions who'll go, no, outright reject it or outright accept it, and come back and give that decision to their constituents. And I don't think that's right.
No, you gotta.
Yeah.
I don't think that's right either. I think, and that's where we have to change our overall system. And so that's really what I was getting at. Like we have changes that happened after COVID, and I want to kind of go into that because we had healthcare issues prior to COVID. Obviously, our healthcare system was what, but for context, I need everybody to understand that it exponentiated after COVID. Like, those problems galvanized. They're a lot worse now. And so if there was burnout before, you got to understand that there's increased
extreme
burnout now. And
they got new terms for it now. There's new euphemisms for it now, right? The silent quitting, the aggressive, something. I forget. There's like 2 or 3 different euphemisms for it now, for burnout. And it's burnout.
Right. And for anybody that really wants to dig into this, like, just do a quick Google search. Like, nursing turnover right now is I can't even begin to tell you. And it all happened during and after COVID. As the levels of stress that you have to endure during a shift is insane. And it's this to me, like, you can't blame the hospitals for all of this. I'm sorry. You just can't. It's not fair.
It's a circular thing. It's one of those things where if you try to point at one thing, you'll have 3 or 4 other things pointing back either at yourself or another situation.
Like, if I'll overhear people, just talking bad about, where they work, and I can't say it's just them. Sometimes we do it ourselves, but like, for me, have to remember, it's not the place I work. It's not all of their fault. It's not all of our fault. It's the environment that we're in right now. It's the global economic environment that we're in, and we are a capitalistic society. And so, board of directors that you need to, respond to, and those board of directors, exactly. And then those board of directors have to be responsible or be accountable to the shareholders, because the shareholders are the ones that have kept that they put their money in. They're the ones that you ultimately have to make happy,
which comes back to us then.
Exactly.
How crazy
is
that?
There's this trickle down of just, or passing up and down or back and forth with energy and responsibility and stress, that's a continuous flow, and that's really our engine. So you can't put all the onus on the hospitals. You have to me, in my opinion, you got to put a lot of onus on our government, because they're the ones that ultimately can change this and control this.
So you alluded to something, and I want to clarify. Okay. So are you alluding to socialized medicine or some type of input from the government in our healthcare system?
I do. I'm not talking about socialized medicine. I don't ultimately.
I know that's a charged word.
I don't think that would work.
I don't think most people actually understand what that actually means either. Like, as a tangent, I don't think most people understand what socialism is and what it would actually take for something like that to occur. And we're not going to get into that today. Maybe at another, another episode or something. But understanding what socialized medicine, we don't have a proper working socialized medicine in the world right now. We have good ones, we have good models, but they themselves have their own issues as well, I think, for that type of work. But I think I do agree with what you're saying, though. There has to be some type of collar, a chain. It's like, and I don't mean to be graphical in that aspect, but there needs to be some type of, ceiling, a cap, a red line where if they see, you're passing something, or you're just being overtly, dismissive or negative or whatever the case may be, where there is a fail-safe that triggers and says, okay, before this gets out of hand even further, we need to rein it back in a little bit.
Yeah.
Right? Not to get into the nitty-gritty, not to get into, the how, right? Because I think capitalism does that beautifully. I think that that's been shown, right? Innovation is created through it. But then, free innovation, not like corporate comes and eats everybody and takes away their things and doesn't do anything with it, right?
Yeah.
We see a lot of big companies get eaten out by little companies, or I'm sorry, reverse. Big companies eat little companies, and the little companies' products, whatever, never comes to see the light of day because the big company right now has invested X amount of money in this. But even though this is better, but because they've already started on this, they'll put this on hold. And if they're smart, they'll use this as an upgrade eventually, but
when they figure
it might
it
not
out.
necessarily be to the best of, the public's interest.
Yeah.
And moments like that, I think there should be a, pause moment.
Yeah, no, I absolutely agree. Like, and I'm one. If I know we're not getting into the whole socialism, capitalism thing.
It's hard not to, though, right?
But I'm one that believes in some aspects or most aspects of capitalism. Just like you mentioned, it creates that competitiveness of the market, and that competitiveness of the market will force innovation amongst all the competitors. And it's just, to me, it's a game. And it pushes us forward as a society, or as a culture, as a humanity, as a globe. Like it just pushes us forward. But nothing's perfect, and it comes at a cost. And you have to understand that how capitalism works.
You have to maintain some type of strategic planning, right? Yes, there will
hierarchy.
There will be a hierarchy. That's the way we, as a society, we function, right? Look at everything that we do in society, right? Whether it's parenting, whether it's government, whether it's corporate, whether it's educational, there is hierarchy. That's just even the pecking order of children, right? With their parents. There's that type of hierarchy. I agree. There will be hierarchy. There will be a need for that, right? Everybody cannot just automatically, have a say in what we do, because then nothing will ever get done, right? Because not everybody agrees. Get two people in the room, and you'll find one discourse at least.
Yeah. Let me ask you a question. So if you have a town, right, and you're assigning the salary, are you going to give the same salary to a garbage person versus one of the corporate lawyers? Like, are you going to give them that same yearly salary? And why not? Why and why not?
So I'm going to pop that. No. So what you're talking about is value-based income, right? And who determines that? Value is a different conversation. But value-based income is something that you have to take into account.
Right.
If I don't pay my garbage man enough to be able to live in that same town, what's the incentive of that person coming into my town and doing that hard labor work?
None.
If they can't feed themselves, if they can't enjoy their life a little bit, right? I'm not talking about extravagance. You want to do extravagance, you work for that, right? You put in the effort for that. So the answer, if I have to say yes or no, the answer is no, obviously. But there's a huge but after that, right? There's a huge, explanation after that. But you have to take into account where your society is, where your town is in respect to everything else that's going on. And people are talking about, globalization as it's a bad thing. I don't think it's necessarily a bad thing if it's done properly, right? If it's done in a way where the very basic needs of human beings are met, right? There will be lazy people. There will be, LeBrons, right? And you'll have everything else in between, right? Not everybody's an all-star. Not everybody can be an all-star, right?
Right.
So yeah, I would not pay the same people the same salary, but I would also make sure that the person that's getting more actually deserves it. And it's in relative. And who sets that? I mean, that's, again, another conversation.
Right. Because, I mean, even just thinking, bringing it down to like just normal business operations, like, or more normal operations of the town, you might need multiple garbage men versus a few corporate lawyers, so you can't pay them the same salary ultimately, because you're going to be spending a whole lot of money. Exactly. And so to get that, the reason why I'm bringing that forward is because I want to kind of bring it to the increased staffing ratios to hold the nurse to patient ratios. And and you have to also understand that it's not always an easy decision for these hospitals to just increase the staff to make these nurse to patient ratios safe, because it's going to cost a crazy amount of money, because nurses are the most numerous employees of a hospital. So
they're the backbone.
So it's also very, very costly, and
unless medical students are going to be taking care of patients for 12 hours a day, 8 hours a day at the bedside, you can't live and you can't operate without nurses. Simple as that, right? Look around the hospitals right now that are being affected by this strike. They're emptying out the hospitals and going to bare minimum, right? Why? Because the nurses are threatening, not haven't, but threatening to walk out.
Right.
And it's crazy. It's such a fundamental necessity, right, for that business that it can be so disruptive. So how you yield that power is also important. But the thing is, I agreed with what you said, but there's an asterisk for me. There's a disclaimer for me. If then society, and by society I mean the work society, so that company's board, that company's CFO, CEO, whatever, they come to that realization on their own and they try to at least mitigate and shield their workers from the external, right? Society as a whole, right, as a businessman, as somebody who owned a restaurant before, if I don't pay my chef, if I don't pay my pizza man, if I don't pay my wait staff, something that allows them the basic necessities, right, comparable to that year's inflation, right, at least close to it, even not if it's not matched, but at least close to it. We need to realize that when we talk about these subjects, the first thing that person's going to think is, well, how is it that you're getting a bonus at the end of the year, but you don't have enough money to hire me a new waitress or another backup pizza man or a backup chef or a sous chef, right? How is it that you brought home the equivalence of that person's yearly wage in a bonus, but you're not willing to, So it has, you have to address that, right? Yeah. People are not dumb. We live in a society that's becoming more transparent. New York State passed a law that says you have to put the job value, right? The salaries, right? The range, right? So in New York, I don't think it's all states, but in New York, at the very least, when you apply for a job, now it's a requirement for that employer to give that range. And the funny thing is, you and I have seen in different hospitals, friends, whatever, they come to us and they tell us, they told me that somebody can't make more than 150, 160 at all in this position. And then this law passed and we saw that it was 170, 180, 200, whatever, right? So how does that make you feel? Right? Then do you have sympathy then after that? No, because you feel betrayed, you feel lied to, you feel whatever. But at the end of the day, you have to, as a nurse, come back and think about this. Go, I'm in healthcare, right? I'm in healthcare. We work in healthcare. As a healthcare provider, I have a moral obligation to my patients, right? So in lieu of a strike, I can't imagine how stressful it is for that person who has to make that decision at that moment, because their income is interrupted, their healthcare is interrupted, everything is interrupted. But fundamentally, that patient's care is interrupted.
Right.
And that's, I don't know, for me, that's really difficult to,
Yeah. I mean, I've talked to a few people, and a lot of them have said the same thing, like, I feel bad for the patients. A lot of them have said, I really care about my patients, and this is it's really sad that it's gotten this far. And I didn't want to get into details about who it was, but I mean, ultimately, I think a lot of nurses don't or didn't want it to get this far and don't want it to get this far. And usually, if nurses truly care about their role and care about their job and ultimately care about their paycheck, I don't think they want this to happen. But I understand why. If this all is about safe patient ratios, I understand why. And because, and here's why I understand why. I want to kind of bring this all together. I think that our healthcare system has changed globally and federally. it's changed, but we are operating like it hasn't changed. We're still using the same operational and business models, and we're not changing as fast as the times have changed. We need to catch up, and I think we need innovation to catch up. I don't have all those answers into what that is, but I do understand that we're not responding fast enough to the changing times. And that's why I think that if this is all about safe patient ratios, and I understand why they're doing this, because we need to catch up. To me, there's no reason why, and I get it's a business, but there's no reason why we can't do what California does. Now, I've never been a nurse in California. I don't know what it's like to be a nurse in California. I can only tell you what I've heard from nurses that work in California, and every last one of them said, oh yeah, it's great. Every last one of them said, it's great, it's amazing.
Yeah.
And that to me sounds like a utopian nursing society at this point, because it's the polar opposite in some places. I mean, I hear like horror stories of nurses, like 2 nurses, and there's like over 20 something patients. Like, how could you take care of 10 plus patients on an inpatient floor? Like,
so can we preface that though? So I don't think ever any company hires just 2 nurses for 20, 30 patients, right? They find themselves in that situation because of sick calls and burnouts and all that jazz. But then the question becomes, what has happened throughout the history of this employment that this is now occurring, where you only end up, instead of having 5 nurses, you end up with 2 nurses on the floor, right? You have to acknowledge that as well. But you're right.
Absolutely. Yeah. I wasn't trying to make it seem like it's all, like I said before, it's not all the hospital's fault. It's just the overall context of the environment that will cause there to be 2 nurses on the floor. There's just, countless stories of just friends that are managers and that are patient care technicians, that are nursing assistants, that are RNs, that are social workers. And there's just countless stories of just the amount of workloads that they've been having to endure for the past few years. And then you have to understand why a lot of them want to retire. A lot of them want to just go somewhere else and just start fresh. Like, it's not an easy time for a lot of healthcare workers, guys. And I hope, if you don't get anything else from this episode, I need you to understand that it's hard for the businesses, it's hard for the hospitals, but it's super hard for the employees right now, because they're dealing with so many stressors, and it's just tough times.
It is tough times. The grass is not always greener on the other side either, though. I don't want you guys to listen to this podcast and go, we're all moving to California. Right? If you talk to those same nurses from Cali, what you'll hear is that they don't have as many nursing assistants, right? Because if you're only taking care of 4 patients, let's be realistic. There shouldn't be a reason why, that you guys can't help each other, right? With less assistant staff, right? We can't have everything, right? Because we have to take that money and allocate it somehow, right? And reallocate it. So some positions will be cut. Some positions will be reduced. And if people don't know that, and this is the first time they're hearing that, I beg you to go look that up. And if I'm wrong, please put it in the comments, bring out the situations. But for the most part, in general, and don't go to that one hospital, right? Look at across the board. What you'll see is a reduction of certain areas,
positions,
and they'll maintain the nurses, right? So it's, like I said, that razor edge that they walk sometimes between keeping that balance.
There's a cost with everything, and that, you have to understand that. Like, just because a hospital's going to give you more money, that doesn't mean that they're not going to take it away from something else. Like, you might not get that piece of equipment that you thought you were going to get next year. Like, there's like they have to. It's a business too. Like I said, you have to make those shareholders happy. You have to make the board happy. You got to make the presidents and the CEO. You got to make all those people happy to keep the ship going. Because if the ship doesn't keep going, none of us get paid at the end of the day.
Exactly.
So,
If a hospital closes, everybody loses. The community loses. The people who work there loses. I mean, I used to live in Jersey, and in Jersey City, they closed down a couple of hospitals when I was working in, not in that hospital, but adjacent sister hospitals and stuff like that. And it's detrimental. It's detrimental, right? People get reallocated. People get, they'll still help them, right? They're not monsters. They'll at least up the equivalents, right? But not necessarily what that person wanted, right? So then you have to now make a decision. Am I going to stay? Am I going to go? And, it's disruptive. It's very disruptive on everybody's account. Everybody's account.
Yep.
Yeah.
So, I mean, here's what I want to see. I do want to see the government step in some way, shape, or form. And the same way they're pushing mental health and mental health reform, I think we need some honest discussions about safe patient ratios at any and every hospital. To me, I mean, if the studies are showing that if we have safe patient ratios, that increases, the patient outcomes, that increases staff satisfaction. We have all this data that is showing us otherwise. So we need to support our nurses, support our hospitals as well, and the government, to me, should be doing that. They need to be the ones that are, jumping in and saying, "Hey, this is the way it is. This is the way we're going to move forward, and let's keep it pushing." And that's what I'm expecting.
Can I also add something to this? I think one of the things that people have lost an opportunity on is those opportunities that when your hospital comes down and says, we're going to create this committee, that committee, this whatever, the more the nurses are involved in that and are sitting at those policy tables, you'd be surprised. It's those hospitals that the satisfaction is higher, the employment attrition is lower, and the overall feel. You can walk into a hospital and know this is a robotic hospital if you work in healthcare at least. You can I can walk into a major hospital and go, this is a robotic, this is a community, this is a family style, this is everybody hates each other and they're about to kill each other. It's palpable. If you've worked in hospitals long enough, especially as a nurse, you can walk onto a unit and go, I know exactly what type of culture this is, right?
Yeah.
Right. It's very apparent. The environmental readiness, the way they interact, call bells, that culture is apparent. Yeah. And if you want satisfaction, if you want better wages, if you want, be involved in those. When your CNO or your CFO or your president, whatever, holds a town hall, participate in it.
Yeah.
Participate in it. Because if you don't tell me as a CEO, as a CNO, as a whatever, medical director, what the issues are, I'm going to think that everything's peachy keen. Mm-hmm. And then 3 years from now, 2 years from now, when we have to do a contractual, agreement, right, renegotiation, all of a sudden there's this laundry list of things that are expected to be fixed within a very unrealistic short amount of time. Mm-hmm. That's just not even feasible. So that it creates points of contention. It creates emotional, some of these, it's crazy.
Yeah. I mean, at the end of the day,
it's preventable.
If you were the person that had to finance all of these things, you would be having a coronary somewhere. Because the first thing you're thinking is, where is this money coming from? Where are we going to pull from? How am I going to explain this? I wouldn't want your job. So those people, to me, they deserve their $1 billion.
They deserve their bonus. They deserve their bonus. I don't think they deserve $10 million bonus or, $5 million bonus, but they deserve their bonus.
Give them milk. Right? Give them a smooth milk.
Whatever their salary is, double it. Fine. No problem. Yeah. But when you double, triple their own salary as a bonus, come on. That's excessive, in my opinion.
Yeah, no, I got you. Yeah.
So, one last thing. I don't know if we have time to talk about this or not. Maybe we'll make this for another episode. I want to talk about how we ourselves are contributing to this downfall through our professional growth, and more specifically, how schools are just pumping out nurses that are not prepared. And I don't want to just say that it was purely COVID, because I think a lot of people have jumped to become nurses with the wrong intention, and it's apparent. When you interview them, it's apparent.
Yeah.
It's like you came in because you wanted a safe and predictable paycheck.
Yeah.
Right? And you come across this monstrosity of issues, patient loads, acuity, and they just jump ship quickly. And I don't think our schools are preparing them adequately enough. I really don't.
So I have to agree, and I want to peel back the layer just a lot of it, actually. So I'm happy you mentioned the business aspect of it, and we've been talking about capitalism, and it seems to be a rhetoric throughout this episode, and that's no different to schools. That's no different to any universities, nursing schools, any of these schools. Everybody was trying to get some money because places were closed, right? So yes, you're right. You can't blame it all on COVID, but I think just being a capitalistic society, the quality of how we're producing employees now, staff now, how we're producing students and preparing them to become nurses or whatever it is, that it's not the way it was before COVID. It was not the way
Even
it was
med
5
students.
years ago.
Even medical students, not just nurses, even medical students. God bless them.
Schools
They go
in
through-
general.
Schools in general. It's like, I don't think they're giving them that realistic notion of what it is you're actually getting yourself into.
Right.
Right?
And I mean, I've heard stories of nurses that just graduated, and they haven't even had clinicals. So a lot of times, this is their first time touching patients, getting the experience of just communicating with the patient by the bedside. Their clinicals were virtual. And I love virtual learning. I am not against it, but I feel bad for those students that haven't had those opportunities, because I can only imagine the amount of stress that they're having when they're first interacting with patients, and they're having to bathe them and touch them and have conversations with them and deal with the negative emotions that they might have. Yeah. So I feel bad for you. I just the nervousness that you might be feeling. So if you're listening to this, the best advice that I want to give you is, just if you do get a role, if you do get a job in a hospital, just jump right in, ask a lot of questions, and then jump right in, because you have a lot to absorb in a short amount of time. That's not to scare you. That's just to honestly prepare you, because like he just said, they're not telling you these things when you get there. Well, when you're in school, rather.
Yeah, absolutely. I actually interviewed a person who was a new grad, and he wanted to become a nurse practitioner. And I said, that's fantastic. I said, when do you want to start that? She goes, already I'm in it, and that's why I'm looking for this new position. So the person was working in the ED, graduated less than 6 months ago, went straight into the ED, but wanted to become a acute care nurse practitioner. So this is somebody who works in critical care areas. And I said to her, what do you mean you've already started? She said, I'm in a dual accelerated program where I graduated with my BSN, and I'm working on my MSN DNP track to become an acute care nurse practitioner. And I said, but do you understand what you're learning right now? She goes, no, and that's why I want to come into this field here, because I don't feel like I'm getting that exposure in the ED. And I said, but why are you actually enrolled in this if you don't actually understand what it is that you're doing? And she couldn't answer that. And to me, that's an indication that I think schools, you need a wake-up call. You're about to literally destroy our profession, in my opinion. And I don't know if that's by design or by, by happenstance, but this dilution of nurses and experience is going to ultimately hurt the profession, both as an RN, as an advanced practice nurse. And to me, I'm not saying that everybody needs a minimum of 5 years, right? Everybody's background is different. Everybody's exposure, learning curve is different. But straight out of graduation into something else, it's mind-blowing to me.
And the only thing that I can think of, the only reasoning that I could think of is trying to get that money. Trying to get that money, and then it doesn't matter. It doesn't matter. What did we just say yesterday? It doesn't matter if it doesn't make sense. What matters is that mighty dollar at the end of the day. You have to make those shareholders happy. Yeah, man. It's scary. It's honestly scary, because I'm looking at just let's not even, if you want to just deviate from healthcare, just customer service. I go into any retail store, and we're producing these behaviors that just are not what they were when I was in customer service, when I was in retail. Like I could go, I went to the mall just 2 days ago. I went into the store, and the cashier did not even look at me and my wife. Didn't say hi, no greetings, no nothing. No
acknowledgement of another human being.
It was just on the phone behind the cash register, and just either scrolling or texting away. And I'm like, man, if I was the owner of this store, I would have been like livid at the moment, because you missed an opportunity to at least greet the customer. You missed the opportunity to make a sale. Like, you're not doing what I'm paying. I'm not paying you to sit behind a register. I'm paying you to work, and I'm just thinking, like, this is what we're producing. So it's beyond healthcare. It's the same type of people we're producing, I guess.
Yeah, same thing in healthcare. I'm walking down the hallway and I see nurses, right? And now it's become more normalized to be on your cell phone or whatever, but not on Facebook, not on Instagram, not on, Amazon shopping. Yeah. If I walk past you and you're texting your family, or you're texting, a friend or whatever, okay, it's a quick conversation. It was obviously important enough for you to take your eyes off of your patient to do that. But your example, right? And when I interview people at work, I ask them, healthcare is medicine, but the other side of it is, customer service.
Yeah.
That cashier who did not even look at you, acknowledge you, right, is a representative of that store. As a customer, I interact badly with that store. Guess what? Next time I want to buy something, I'm going to go to the store next door, because I don't want to deal with that person anymore. Even if that person doesn't work there anymore, it's left a bad taste in my mouth. As a consumer, I have options. I don't have to come to your hospital. I don't have to come to do that. I choose to do that. And a lot of companies have realized this and started using that mantra in their logos, right? Where we want you to choose to be here, right? Or something derivative of that.
Yeah.
But you have to then make sure your employees understand what that culture is supposed to mean, right? Yeah. And hopefully society as a whole.
Right.
Yeah.
It's scary, like I said, and I can't emphasize that enough. You have a lot of new nurses that are coming in, and they're having to learn how to be nurses in this chaotic healthcare environment. Workplace violence is increased. You have just mental health issues. I mean, I've had multiple nurses come to me and say, my mental health is jacked up right now. And I get that's a whole social push now, but I understand. I understand.
As somebody who used to be like, mental health, whatever, even as a healthcare worker, my own personal thoughts are like, you can probably do it on your... No, like, I've come to that. I've seen the light. It's not a bad thing. That mental health thing, it's, if you are suffering anxiety, sadness, whatever, I would love for you to actually talk to somebody. And there are a lot of resources, because if you can't mitigate your own anxiety, you can't be an effective human being. It's simple.
Yeah. I mean, oh man. It's what, so my point really is that there's so much of it, and we all need to mitigate it together, because we're all going through it in different levels. And I don't care if you're the CFO, the CNO, or I don't care if you're the security guard. I don't care who you are. Like, if you're working in healthcare, or just mostly any industry at this point in time, but just healthcare right now, you're dealing with short staff.
A lot.
You're dealing with short staff. You're dealing with, some patients that, let's just be frank, are rude, like ungrateful,
Rude,
just downright mean. Just downright mean. And you can't really blame them, because they're probably dealing with their own external societal issues. And, it's being, I guess, pushed on to you.
And we get them at their worst part of their life, right?
Yeah.
They're sick enough to be in a hospital.
Yeah.
That's not normal.
Yeah. You're dealing with a myriad of emotions. You can be happy at one moment, and then, you might have a patient that you actually liked and they died. You're dealing with the upset family member that comes in. You're dealing with the parent that might come in, and they might have had a bad day at work, and, and they're not understanding that you only have 2 hands and 2 feet and 1 head, and you got a million patients and a million things to remember, and you miss one thing, then you're gonna get in trouble by your manager. Like, you have all of these different things that are probably going on in your head, and I know, because I felt that. And you have to be a normal, sane person to another human being that absolutely can't take care of themselves. And it's a daily mental challenge, in my opinion. It's a lot for one person to take. And then you have to go home and deal with your family if you have that.
That's the icing. And hopefully that's a source of comfort and not stress. But, everybody's situation is different.
Yeah.
But what I don't want from this episode to be conveyed is that it's all negative, and it's all scary, and it's all frightening. And you guys got to understand something. When you sign up to go into a profession, I want you to understand that you walk into that profession as what I call a, informed consumer, right? As an informed consumer, you should know what you're getting yourself into. Please do your due diligence, because we're talking about all the negatives for the most part, right? But the equivalence of that satisfaction, right? It's massive. It's life altering. It's humbling. It's it can bring you to tears just at the thought of it. Like, the humility that you experience throughout of it, right? It's just the humanity, right? The humor of it. Not to boast my own sayings, but it's true though. It's one of those privileges that we have to help somebody. But understand that as a nurse, you will deal with isolations, with, pandemics, with disease processes, contagions, stuff like that. If you're a warrior, right? If you're a military personnel, and you're shocked that you're at the front line and somebody's shooting at you, then obviously you didn't do your homework before you signed up for the military, right? If you are walking into healthcare, understand that you will be dealing with disease processes, diseased human beings, diseased mentality, diseased society. You're dealing with disease of everything in society. And I think this is why nursing in itself is so integrated in so many aspects of society, right? You have that privilege to be a ripple for positive and everything else. So you guys, we have a lot of power. I just wish that everybody were to stand back and go, okay, is it just about me today, or is it about all of us? Because I want to survive tomorrow.
Yeah. I'm actually extremely happy you mentioned that, because we might have created a somber episode, and I don't want that, because nursing, and as you were saying it, like as nurses, or I'll even just talk about myself, like, even having this hindsight of everything that I've experienced, all the deaths, all the crazy patients, all the times you wanted to come home and cry, like even with all of that hindsight, I don't think I would have wanted to be any other type of healthcare worker. Nursing has been a blessing on my life. You know, I've been able to, I wouldn't be who I am today if it wasn't for being a nurse. You know, the experience to me shaped who I am today. And so I wouldn't take it back at all. And I think that part of these conversations, you know, helps me realize that it's also part of my, I guess, responsibility to help push the field and the career forward in a positive direction. You know, and it's not just me, obviously, but, you know, I have my own oar and I need to be rowing it in the direction where we're all deciding to row it. And, you know, yes. And I want to be a part of that. And so, you know, like I said, nursing is a great field to get in if you really want to get into it, but just understand what you're getting into. Yeah. This was episode 3. And any last words, sir?
Live life to the fullest and enjoy wherever you are, even your mistakes. Learn from it, grow from it. And just, even if it's a bad day, you can make up for it the next day. Nice. You can hit the reset button.
Love it, love it, love it. This has been another episode of Better Nurse Corp. It's your favorite color in the world, brown, along with my co-host Ruse. And stay tuned for episode 4. Peace.